experience discomfort or pain during intercourse? Common indicators of dyspareunia include sharp or throbbing pain during penetration, deep discomfort during sexual thrust, aching or cramping sensations after intercourse. If you are experiencing ongoing pain during sexual activity, it's essential to reach out for help. We are excited to invite you to join us for a special live event focused on a crucial yet often overlooked topic, painful intercourse. Our team will be on hand to provide valuable insight, answer your questions, and help raise awareness about the causes and treatment of dyspareunia. It's crucial to understand that dyspareunia can lead to significant emotional and psychological distress. It's essential to address these underlying causes to find effective treatments and relief. Do you experience discomfort or pain during intercourse? Common indicators of dyspareunia include sharp or throbbing pain during penetration, deep discomfort during sexual thrust, aching or cramping sensations after intercourse. If you are experiencing ongoing pain during sexual activity, it's essential to reach out for help. We are excited to invite you to join us for a special live event focused on a crucial yet often overlooked topic, painful intercourse. Our team will be on hand to provide valuable insight, answer your questions, and help raise awareness about the causes and treatment of dyspareunia. It's crucial to understand that dyspareunia can lead to significant emotional and psychological distress. It's essential to address these underlying causes to find effective treatments and relief. Hi everyone! Welcome back to the Anna Hu channel live sessions. I'm Dr. Anna Hu, founder and medical director of Anna Hu Clinic, an award-winning wellness and medical aesthetic clinic here in Kuala Lumpur, Malaysia. Today, we are revisiting an important and often overlooked topic, dyspareunia, or in simple terms, pain during intercourse. This is the second time we are diving into this topic because after the first sessions, we received so many thoughtful questions and messages from women who realize they are not alone in this experience. So in today's live, I'll be addressing more of your questions, things like what causes pain during intercourse? Is it just hormonal? Can it be treated or managed? When should you seek help? If you have ever felt discomfort or pain during intimacy and didn't know who to talk to, or if you are simply looking for clarity, this session is for you. So, why are we talking about dyspareunia and why is this so important to understand? One common question that often comes up is it normal to feel some discomfort during sex, especially as we age? Well, the answer is no. Pain during intercourse is not something you have to just accept as part of aging. So in many cases, it's linked to treatable issues like hormonal changes, particularly during perimenopause and menopause. You see, hormones, especially estrogen, play a key role in maintaining vaginal health. When hormone level drop, it can lead to symptoms like vaginal dryness, thinning of the vaginal tissues, reduced elasticity, and even inflammations, all of which can cause discomfort or pain during intimacy. But the good news is, you don't have to live with it. Restoring hormone balance along with targeted medical treatments can help improve these symptoms significantly. This isn't just about improving physical comfort, it's about restoring confidence, emotional intimacy with your spouse, and quality of life for yourself. Everyone deserves a fulfilling and pain-free intimate life, no matter their age. I'll be here to debunk the myth and answer all your questions one by one. So let's get started. Before that, let me introduce our Ask and Win session. Got a questions about dyspareunia or pain during intercourse? Don't be shy. Ask away during our live sessions and you might just win our complete essential kit. So what's in the kit? An amend, which is good for energy and cellular health, Collagen Forte, which is good for skin glow and firmness, Plant Pro Plus, a protein for daily nutrition and gut support. This kit is packed with essentials to help you feel and look your best, beauty inside out. Okay, so 5 winners will be announced tomorrow on the Anna Hu channel Facebook page. So make sure to follow us and stay tuned. Let's start by understanding what dyspareunia really is. First, let's watch a quick video to help us out. What exactly is dyspareunia? And how can you tell if the pain you are experiencing during intercourse is something to be concerned about? Do you experience discomfort or pain during intercourse? If so, you are not alone. Dyspareunia or painful intercourse is a common condition that can affect individuals of all gender. So what exactly is dyspareunia? It refers to a persistent or recurring pain experienced during or after sexual intercourse. This discomfort can manifest as external pain in the vulva or internal pain in the vagina, uterus, or pelvis. It's crucial to understand that dyspareunia can lead to significant emotional and psychological distress, impacting intimacy and overall relationship dynamic. If you are experiencing the above pain during sexual intercourse, you might want to arrange a consultations and assessment sessions with your gynecologist or urologist or your healthcare practitioner to conduct a thorough evaluations, which include a detailed health history and physical examinations, pelvic exams to assess your reproductive health, tests like ultrasounds to explore potential medical issues. We understand that discussing sexual health can be sensitive, but the trained healthcare practitioner will be able to help you every step of the way. At Anna Hu Clinic, we are committed to helping you overcome the challenges of dyspareunia. Our compassionate and knowledgeable team is here to guide you towards the pain-free, intimate life you deserve. Welcome back. Let's recap what we discussed in the video. When we talk about dyspareunia, many people assume it's just pain around the vulva, but that's not the full picture. Dyspareunia actually refers to any persistent or recurring pain during or after sexual intercourse. And the pain isn't always in one spot. It can happen externally around the vulva or internally in the area like the vagina, uterus, or even deep in the pelvis. So some people describe it as a sharp sting. Others say it feels like a deep ache, throbbing, or even cramping after intercourse. While it's more common among women, men can experience it too. The pain can be physical, but it often takes an emotional toll too, affecting confidence, intimacy, and relationship. That's why recognizing and addressing it is so important. You are not alone, And more importantly, you don't have to just live with it. We can overcome it. Now, I've got a questions for all of you. Feel free to share your thoughts in the chat. If you ever experience pain like what we just described, sharp, deep, or aching discomfort during or after intercourse, would you seek help from a medical professional? Type yes if you believe it's important to get it checked out. Type not sure if you have ever felt shy or unsure about bringing it up. No worries, we'll talk more about this later in the sessions and clear up the doubts together. Alright, let's kick off our Q&A sessions all about dyspareunia, or what we call as painful intercourse. Do you have questions or concern? Don't be shy. Drop your questions in the comment during our live sessions. Whether it's about symptoms, causes, or treatment options, we are here to help you understand more. Plus, you might just win our complete essential kit. We'll be picking 5 winners and the result will be announced tomorrow on the Anna Hu channel Facebook page. So don't forget to follow us and stay tuned. Let's get the conversations going. Let's jump into one of the most common questions we get when talking to patients about dyspareunia. How can I talk to my doctor about painful sex without feeling embarrassed? It is completely understandable to feel shy or embarrassed when talking about painful sex, but remember, your doctor is here to help, not to judge. You can start the conversations with something simple like, I have been experiencing some discomfort during intimacy, and I'm not sure if it's normal. This opens the door for your doctor's healthcare practitioner to ask more questions and guide the discussion. You don't need to have all the right words. Just be honest about what you are feeling. Also, remind yourself dyspareunia is a medical condition. Just like a headache or a stomach pain, it deserves proper attention and care. The more openly you talk about it, the faster you can get the right support and start feeling like yourself again. And the next question is painful sex ever a sign of something more serious, like cancer? Painful sex or dyspareunia is often caused by treatable issues like vaginal dryness, hormone imbalances, pelvic floor tensions, or infections. However, in some rare cases, it can be a symptom of something more serious, such as endometriosis, ovarian cysts, or even cervical or vaginal cancer, but don't panic. Pain during intercourse is much more commonly linked to non-cancerous conditions. Still, if the pain is persistent, worsening, or comes with other warning signs like unusual bleeding, discharge, or unexplained weight loss, it's important to see a healthcare practitioner or your doctor. Getting checked early doesn't just rule out serious issues, it also helps you get the right treatments sooner. The bottom line, listen to your body. If something doesn't feel right, don't ignore it. Speak to a medical professional or your doctor. You deserve clarity and comfort. There is another question here. Can hormone therapy help? Yes, hormone therapy can help, especially if your painful sex is caused by hormonal changes, like those that happen during perimenopause or menopause. So when estrogen level drops, the vaginal tissues can become thinner, drier, and less elastic. This can make intercourse uncomfortable or even painful. Hormone therapy, like vaginal estrogen creams, tablet, or rings, can help restore moisture and elasticity to the vaginal walls, making intimacy more comfortable again. But hormone therapy isn't one size fits all. A proper consultation with your doctor or healthcare practitioner is important to understand whether it is right options for you, based on your symptoms, health conditions, and goals. So, yes, for the right person, hormone therapy can be a game changer. Alright, now let's talk about the causes of a dyspareunia. What signs should we be looking out for? Let's watch this video to dive deeper into the symptom. Do you experience discomfort or pain during intercourse? If so, you are not alone. Dyspareunia or painful intercourse is a common condition that can affect individuals of all gender. Now let's talk about the symptom. Common indicators of dyspareunia include sharp or throbbing pain during penetration, deep discomfort during sexual thrust, aching or cramping sensations after intercourse. The causes of dyspareunia can be quite varied, including medical conditions like hormone changes, pelvic floor dysfunctions, and infections can all contribute to painful intercourse. Physical trauma, injuries from childbirth or surgery, as well as conditions affecting the bladder or bowel may lead to discomfort as well. Psychological factor, anxiety, stress, or previous trauma can exacerbate pain during intercourse. It's essential to address these underlying causes to find effective treatments and relief. We understand that discussing sexual health can be sensitive. At Anna Hu Clinic, we are committed to helping you overcome the challenges of dyspareunia. Our compassionate and knowledgeable team is here to guide you towards the pain-free, intimate life you deserve. Welcome back! As we have seen in the video, dyspareunia or pain during sex or painful sexual intercourse is not just a result of aging. The causes can be varied and complex, including hormonal changes, infections, pelvic floor issues, past childbirth trauma, or even emotional factors like stress and anxiety. That's why it's so important not to ignore the pain or brush it off as normal. If you are being quietly enduring discomfort, I truly encourage you to seek a proper diagnosis. So at Anna Hu Clinic, we take a holistic and respectful approach through detailed assessment, pelvic examinations, and even imaging if necessary to uncover the real cause behind your pain. So don't suffer in silence. If you are experiencing pain, that's your body telling you something isn't right, and there are solutions. Let's work on it. Let's get back to the Q&A sessions. I have another question from the audience. How can I talk to my partner about this without damaging intimacy? I personally think that open and honest communications is key. Choose a calm, private moment to talk and focus on how you feel rather than placing blame. You might say something like, I've been experiencing some discomfort during intimacy, and I think it's important for us to figure this out together. Reassure your partners that you are bringing this up because you value your relationships and want to improve your connection, not avoid it. Including your partner in your journey to seek help can actually strengthen your bond. Another question from the audience. Are there any natural remedies for vaginal discomfort? Yes, there are several natural remedies that may help relieve vaginal discomfort, especially when it's related to dryness or irritation. However, it's important to remember that these remedies are not one size fits all, and persistent discomfort should always be evaluated by a medical professional. Here are a few natural options, like coconut oil or vitamin E oil. Natural oil can serve as gentle, chemical-free moisturizer or lubricant. Coconut oil in particular is soothing and has mild antimicrobial properties. Aloe vera gel. Pure aloe vera without added fragrances or alcohol can help soothe irritations and dryness. Hydrations and diet. Drinking plenty of water and eating food rich in omega-3 like flaxseed, walnut, and salmon can support natural moisture and tissue health. Probiotic. Oral or vaginal probiotic may help maintain healthy vaginal flora, reducing the risk of infections or irritations. Avoid harsh product. Switch to fragrance-free, pH-balanced soap and avoid douches, which can disrupt the vaginal environment. That said, natural remedies are best used alongside proper diagnosis, especially if you are experiencing persistent pain, burning, or unusual discharge. If symptoms continue, consult a doctor to rule out underlying conditions like infections, hormone imbalances, or pelvic floor issue. There's another question here. Do lubricants help with pain during sex? Any recommended type? Yes, lubricant can definitely help reduce pain during sex, especially if the discomfort is due to vaginal dryness, which is a common symptom of hormonal changes, like during menopausal period, stress or certain medications. How lubricants help? It will be able to assist in reduce frictions and irritations during penetration. It will help to provide immediate relief for dryness. It can make intimacy more comfortable and enjoyable. So recommended types of lubricants are like water-based lubricant, silicone-based lubricant, oil-based lubricants like natural oil, coconut oil or almond oil. And things to avoid is like flavored or scented lubricant, which can cause irritations. Product with glycerin or parabens may lead to infections or sensitivities for some. If lubricants don't fully resolve the discomfort, it's a good idea to consult a healthcare provider to check for underlying conditions like hormonal imbalance, infections, or pelvic floor dysfunction. Okay, now let's answer some of the questions in the comments below. So one of the question is, what causes pain during intercourse? So indirectly, this is what is dyspareunia? This is a question from Madam Lam. So pain during intercourse, also known as the dyspareunia, can be caused by a variety of factors. Some common causes like what we have shared just now. It could be a physical conditions like infection, conditions like urinary tract infection, or it could be sexually transmitted disease or yeast infection, which all of this can lead to discomfort. So besides the physical conditions, it could be also because of aging sign like vaginal dryness. Insufficient lubrications can be due to hormonal changes like, for example, menopause, or during breastfeeding periods post-delivery, or it could be due to certain type of medications. Some disease conditions like endometriosis, it could be one of the reasons why as well. This is a conditions where the tissue, which is similar in the lining of the uterus, which is growing outside of the uterus, which eventually cause pain during the intercourse. Not to forget as well, one of it is infections, for example, pelvic inflammatory disease, and infections of the reproductive organ that can cause the chronic pain. Other form of reasons, like for example, it could be growth, like fibroid or cysts, hormonal changes, like fluctuations in the hormone, especially when there is a change in the estrogen level. It can also lead to vaginal differentiations in the lubrications and the sensitivity of the vagina. And this is particular happening during the menstruation period, during breastfeeding, during the menopause, or when an individual is under stress, which is also involved of the psychological factor. Anxiety, stress, past trauma, or relationship issue can eventually lead to the influence in the sexual pleasure, which can contribute to pain during intercourse. Not to forget as well, some of the medications can lead to more sensitive vagina, such as antidepressants and some hormonal therapy, which leads to dryness, or it might change in the patient's libido. And sometimes psychological causes might lead to muscle tensions or muscle spasm, or what we can call it as a vaginismus, involuntary muscle spasm in the pelvic floor, or chronic pain in the vulva, vulvodynia, can also lead to painful intercourse. And some more common causes are like injury or trauma, for example, previous injury to the pelvic area, or post-surgery when the area which is not really healing that well, or sometimes that might be having scarring like hypertrophic scar or keloid scar, which might eventually leads to painful intercourse as well. So those are some common causes, like besides what we have shared during the video just now. Now maybe we can move on to the next questions by Madam Wong. So can exercise help to ease the pain? So yes, exercise can be beneficial in reducing pain during intercourse for some individuals, especially those who have muscle spasm or muscle tension. So how exercise can assist those individuals in reducing the dyspareunia? Because exercise is able to strengthen the pelvic floor muscle, and exercises like Kegel exercise can help strengthen the pelvic floor muscle, and this eventually will improve the muscle control during the intercourse and potentially reduce pain and improve on the patient's experience of sexual intercourse as well. Besides regular exercise, it will improve the blood circulations around the vaginal area. This will eventually help in overall sexual health and to alleviate the discomfort. At the same time, exercise will also reduce stress and anxiety. Exercise is known to release the endorphin, which can improve the mood and reduce anxiety for those people who have anxiety during sexual intercourse. And the other way the exercise able to help in dyspareunia is exercise able to assist individual in increasing flexibility, such as yoga or Pilates. This exercise will enhance the flexibility and can reduce tension in the pelvic floor muscle. Okay, then maybe we can move on to the next question by Madam Lam again. Taking hormone replacement help? Yes, hormone replacement will be able to assist in reductions of pain during intercourse for some individuals, particularly those who are experiencing hormone imbalance during the menopause or post-childbirth, or for those people who are under certain medical conditions. How does hormone replacement therapy able to help in painful intercourse? Number one, hormone replacement therapy can increase the vaginal lubrications. So hormone replacement therapy usually will contain estrogen. So HRT will restore estrogen level, which will increase the vaginal lubrications. HRT will also relieve the patients from vaginal dryness. Estrogen therapy, whether systemic or local, either the patient's taking an oral pill or using a vaginal gel, it will be able to help to reduce the vaginal dryness. This is common issues, especially for those ladies during perimenopause or in the menopause period. So HRT will also increase the blood flow because estrogen can enhance blood circulations to the vaginal area and promoting sexual arousal and comfort during the intercourse. So HRT, like estrogen and progesterone, will be able to reduce other menopausal symptoms. For example, hot flushes, reductions of mood swing, and other symptoms of menopause eventually will contribute to overall better sexual experience and comfort. Then maybe we can move on to the next question. Does positioning during sex helps to reduce the pain? Also by Madam Lam. Yes, positioning during sex can play a significant role in reducing pain for individuals which experiencing dyspareunia or painful intercourse. Here are some of the considerations that maybe patients can consider. Number one, patients can find a comfortable position. Certain sexual positions may allow for better control over depth and angle of penetrations, and this can help to minimize discomfort. And besides that, certain positioning during sexual intercourse, for example, lying side by side can also reduce the pressure and allow for a more gentle type of movement, which will be able to alleviate pain as well. And one of the commonest sharing that we will share with the patient is, for some patients, they might find more comfortable in using supportive pillow, which will incorporating pillow to support the lower back or pelvis. And this will be able to help in adjustment of the angle and support comfort during the intercourse. Wow, this is a bit more detailed type of questions. And the next question is from Madam Wong. Is dyspareunia a normal aging sign? Yes, dyspareunia is very common, especially for those ladies who encounter menopause and for those post-delivery. So menopausal lady, very commonly they will have low in estrogen and low in progesterone. And eventually, when the estrogen and progesterone level is low, patients will encounter vaginal dryness. Patients will encounter reductions in lubrications. And there is also changes in vaginal health, where the vaginal lining may be more thinner or less resilient, which can contribute to pain. So sometimes when the patients have low progesterone, patients might have a bit more intense muscle spasm at the vaginal area, which not able to relax that easily. So hormonal replacement will be able to assist in the reduction in progesterone level. And hormonal fluctuations, hormonal changes may also affect libido and overall sexual function and sexual experience for the patient. Okay, maybe we can proceed with the next video before we come back to answer the questions again. Do you experience discomfort or pain during intercourse? Dyspareunia or painful intercourse is a common condition that can affect individuals of all gender. It refers to a persistent or recurring pain experienced during or after sexual intercourse. Addressing dyspareunia requires a comprehensive approach tailored to your specific need. Here are some effective treatment options. Number 1. Medications. Topical estrogen. For those experiencing pain during hormonal changes, especially during menopause, localized treatment can help restore moisture and reduce pain. Antibiotics and antiviral medications. If an infection is behind your symptom, we'll prescribe medications to eliminate that source of discomfort. Botulinum toxin A. This treatment can relax the pelvic floor muscle, alleviating sharp or deep pain during intercourse due to muscle spasm. Hyaluronic acid fillers. When injected, these improve hydration and elasticity in the vaginal area, reducing pain associated with dryness. Platelet-rich plasma, a biocompatible treatment that stimulates tissue regeneration, significantly improving moisture level and elasticity in the vaginal area. Second, pelvic floor therapy. This specialized therapy strengthens and relaxes pelvic floor muscle, helping alleviate pain. Laser and radiofrequency treatment. These advanced therapies promote tissue regeneration and improve blood flow to alleviate dryness and discomfort. Home remedies like lubricants can help or provide instant relief for dryness. Avoiding irritants, opting for unscented product can help reduce discomfort. The management of dyspareunia varies based on its underlying causes, but many individuals find significant relief and recovery with appropriate treatment. With the right approach, you can enjoy a fulfilling, intimate relationship once again. If you are experiencing ongoing pain during sexual activity, it's essential to reach out for help. Open communications with your partner and healthcare provider can enhance your experience and facilitate healing. At Anna Hu Clinic, we are committed to helping you overcome the challenges of dyspareunia. Our compassionate and knowledgeable team is here to guide you towards the pain-free, intimate life you deserve. So welcome back to Anna Hu channel. How to manage and what are the options for dyspareunia treatment? So managing dyspareunia starts with understanding the root cause. Whether it's hormonal, muscular, psychological, or due to infections. Treatment options include hormone therapy to restore vaginal moisture, PRP and hyaluronic acid for tissue rejuvenations, botulinum toxins to relax pelvic muscle, and antibiotic if an infection is present. So physical therapy can help strengthen the pelvic floor, while laser or radiofrequency treatments improve tissue's health. Even simple changes like using lubricants and avoiding irritants can make a difference. So the key is a personalized approach guided by proper diagnosis. If any of this sounds familiar, don't just brush them off as part of aging. Talk to your doctor or a healthcare provider who can guide you through proper tests and the right treatment. Alright, let's kick off the final round of our Q&A sessions on dyspareunia, painful intercourse. Got questions or concern? We are here to support and assist you. Drop your questions in the comment during our live sessions. Plus, you could win our complete essential kit. We are giving away kits to 5 lucky winners. Winners will be announced tomorrow on the Anna Hu channel Facebook page. So make sure to follow us and stay tuned. Let's keep the conversations open and empowering your health matters. I have a question here. If I've tried treatments and nothing works, what's next? If you have tried several treatments and still haven't found relief, don't give up. There are still options. Persistent dyspareunia often requires a multidisciplinary approach. You may need re-evaluations to rule out overlooked causes, a referral to a pelvic pain specialist or gynecologist with expertise in complex cases, combinations therapies like hormonal support and pelvic floor therapy, support for emotional or psychological factors such as therapy or counseling. Remember, managing painful sex isn't one size fits all. It might take time, but with the right team and tailored care, relief is possible. Are there any medications that can make this problem worsen? Yes. Certain medications can contribute to or worsen dyspareunia, a painful sex, especially if they cause vaginal dryness or affects your hormones. Common culprits include antidepressants, for example, SSRI, which can lower libido and reduce natural lubrications, antihistamine or allergy medications, which can dry out mucosal membranes, including vaginal tissues, hormonal medications like certain birth control pills that lower estrogen levels, cancer treatments, chemotherapy or hormone blocking drugs can thin vaginal walls and cause dryness if you are experiencing symptoms. Talk to your doctor about the medications you are taking. There might be alternative or supportive treatments to reduce side effects. Okay, now let's come back to answering the questions in the comment area. So this is a question from Madam Kam. Is counseling or sex therapy ever needed? Um, yes, counseling and sex therapy can be very beneficial for individuals and couples facing various challenges. It will prep the mind before the activity. So here are a few situations where they might be needed. For example, especially when the patient's having communications issues, if partners struggle to communicate openly about their needs and desire, counseling therapy can help to improve their communication skill. Second, situations are like when couple having sexual dysfunctions. For example, concerns such as low libido, erectile dysfunctions, or pain during intercourse can be addressed through sex therapy, which can provide guidance and treatment options. This is extremely important, especially when couples do not know what's going on. So to have an open discussions among each other is extremely important, and not to personalize the challenge to themselves and judge themselves or their partners is also important. Um, Counseling also very helpful, especially in relationship problem. So for couple facing conflicts, trust issues, or differing sexual desire can benefit from counseling to navigate this complexity. This is extremely common during menopausal or andropausal period, because both male and female, they are having challenges in navigating through the change in the hormone level in their body. So sometimes when the female counterpart, they are a bit more tense up, or when the vagina is already dried up, or when the libido is already low. So the need or the desire to have sexual activity significantly reduced. This will also impacted on the male counterpart, where they're no longer able to fulfill their personal desire. So counseling is extremely important during these periods of time to bring both parties together to talk things through what's their desire or their expectations on their sexual life. Besides that, for couple with past trauma will be also benefited from counseling significantly. So individuals who have experienced sexual trauma may need therapy to work through their feelings and regain a sense of comfort and control over their sexuality. A bit more unique situations, for example, for those who have changes in sexuality, these life transitions such as aging, childbirth, or health issue can affect sexual relationship. So therapy can provide support and help couple to adapt and to talk things through as well. Those are some of the common situations where counseling will be able to assist couple in handling challenges in their sexual life, not necessarily dyspareunia only. Okay, then we go to the next question by Madam Lam. What about bleeding after intercourse? So bleeding after intercourse, known in medical term as postcoital bleeding, this could have many different reasons and many causes, some of which may require medical attention. Here, I would like to share some of the potential reasons for these conditions. Number one could be because of infection, like sexually transmitted disease, or some other infections like bacterial vaginosis or pelvic inflammatory disease can cause inflammations and bleeding. So other causes beside the vaginal or pelvic floor challenges, it could be cervical issues, conditions like cervical atrophy, where the cell from the inside of the cervix is growing on the outside, or cervical polyps, which also can lead to bleeding after sexual activity. But more commonly, causes for postcoital bleed are vaginal dryness. So insufficient lubrications can cause friction during the intercourse, which may lead to minor tear or bleeding. By far, this is one of the commonest cause, which is vaginal dryness, which we can handle by increase in lubrications, either hormone replacement therapy or in use of KY jelly. The other reasons, like for example, hormonal changes, the change or the hormonal fluctuations, especially around menstruations or due to birth control pill usage, can lead to bleeding after sex as well. Other reasons like trauma, physical trauma during intercourse, especially if it's vigorous, which can also lead to bleeding. Other reasons are like pregnancy complications. For example, in pregnant individual, bleeding after intercourse may require medical attention. So sexual performance during pregnancy period, it need to be very cautious and very careful for this reason. On other potential cause underlying medical conditions, like for example, endometriosis and potential fibroid can also contribute to bleeding, but these are rare, not very common. So far, I would think that's about it. There are definitely other causes of postcoital bleed, but the best is to get the proper consultation, because postcoital bleed it's not a common situation and require medical attention, so that to rule out other potential dangerous conditions, for example like growth or cancer. Then we can move on to the next questions by Jacqueline. Madam Pang, can lifestyle changes make a difference, like diet, stress management, or exercise? Yes, definitely. Lifestyle changes can significantly impact on overall health and well-being, including the sexual health and function. For example, diet, a balanced diet rich in fruits, vegetables, whole grains, proteins, and healthy fat can improve circulations and hormonal balance, which are essential for sexual health. Nutrients such as zinc, omega-3 fatty acid, antioxidant found in healthy food can enhance libido and improve sexual function. Exercise, like what we have shared just now, regular physical activity can improve blood flow, boost energy level, and enhance mood, all of which can positively influence sexual performance and desire. Exercise can help reduce stress and anxiety, which are common barriers to a healthy sex life. Not to forget as well, stress management. High level of stress can negatively affect an individual's libido and sexual performance and the ability to achieve orgasm. So engaging in stress reduction techniques such as mindfulness, meditations, yoga, deep breathing exercise can help to alleviate these issues and improve emotional well-being through relaxation technique. to enhance the intimacy and closeness and overall relationship satisfaction. Not to forget as well, very important part of our lifestyle is to get a proper sleep. Sleep is important. So adequate sleep is crucial for hormonal regulations and overall physical health. It will impact on our sexual desire and performance. Avoiding things which will contribute to inflammation is important as well. So limiting alcohol intake, quitting smoking, and avoiding recreational drugs can improve the sexual health and performance, as these substances can negatively affect libido and blood flow, making these lifestyle changes can contribute to better physical and mental health. So the next question by Madam Lam. Have less sex, is it the cause too? Having less sex can influence various aspects of sexual health, but it isn't necessarily a direct cause of issues like painful intercourse. However, the more an individual exercise or having the sexual activity, the more well-versed they will be, and they will know how to achieve orgasm better, faster, and how to lubricate the vagina better, and practice make perfect, I would say. Yep. Then we will go to another question by Madam Lam as well. Madam Lam, I think definitely you will receive the reward for this. So from Madam Lam, using KY jelly can, of course. If the issue is dryness in the vagina area, so an individual can utilize the KY jelly to lubricate the area, and this will help to improve the sexual experience. Then the next question is hormone harmful to my body? By Madam Wong. Okay, we will have sessions of hormone replacement therapy, and we have sessions where we talk about menopause, which is the previous Facebook Live that you might want to go through it again. So, is hormone harmful to my body? This is a very interesting question, because hormone is something necessary for our body. So hormone replacement, it's important when the hormonal level is low. If the hormone level is normal, usually hormone replacement will not be commenced. If the hormone level is high, then hormone replacement will not be commenced as well. So the best is to get a proper consultations either with your gynecologist or your general practitioner or your family doctor, so that they will have a proper assessment of your health conditions, and then can proceed for blood investigations to identify your hormonal level, and then you can work on from there with your doctor. So the next question is by Lina Ying. Should I see a gynecologist, urologist, or another specialist? So for painful sexual intercourse, the best person to see is either your gynecologist or your family doctor, your trusted family doctor. So usually the screening will by your family doctor, and if there is no any other abnormality, if it's only purely because of vaginal dryness or because of the lack of exercise, then maybe some suggestions will be given by your doctor, and then you can do have some lifestyle adjustment prior to any further medical assessment. However, if there is abnormality noted or noticed at the vaginal area, then further investigations will be needed. So the best is to get a proper assessment by either your gynecologist or your family doctor. And the next question, can get pregnant with dyspareunia? Yes, definitely. Dyspareunia means painful sexual intercourse. However, sexual intercourse is still able to be performed. So, having said that, dyspareunia will increase the challenge in getting pregnant. However, the patient should be able to have pregnancy. The best is to get the assessment by the gynecologist to make sure the painful sexual intercourse, it's not related to any anatomical or any physical abnormality. The next question is by Elaine as well. How long can dyspareunia last? Generally, dyspareunia, the painful sexual intercourse, durations of lasting is depending on the cause of the pain. So assessment is important. If it lasts more than what is expected, we will suggest you to seek for medical assistance and assessment to make sure that it's not something danger. What age does dyspareunia occur? So the commonest age where patients will have dyspareunia are during menopausal period. The other common conditions are when an individual is first exposed to sexual activity, where they are still navigating through what to do, how to get things right. And post-delivery is also another common period where patients tend to get dyspareunia. So we have another question from Anna Hu Clinic Facebook page. Do you use bioidentical hormone? Yes, bioidentical hormone will be able to assist in lubricating and reductions of dryness of the vagina, as what we have shared just now. Estrogen is important to keep the vagina hydrated and to increase the blood circulations as well. So, okay, I think this time round we managed to answer almost all the questions, and it's time for the end of today's sessions. So stay inspired and stay healthy. If you have any questions, please continue to share in the comment column, where we will answer it even after the Facebook Live. Please like our Anna Hu Facebook channel and for trusted health tips, and thanks for your support, and see you next month. Bye bye.